and they are at the manufacturer's quality. And because healthcare providers, pharmacists, doctors, nurses are at the center of what we do here at Drugstock, we like to ensure that we keep you updated about not just our products, but also the health landscape, like technology in the health industry, basically. So this webinar series, which is digital transformations in healthcare systems, it's about bringing to the fore opportunities in tech or opportunities in healthcare that we can adopt tech in. So it's basically to let us know, to open our minds to all the possibilities that we can achieve with technology in the healthcare industry. This series is one of the many that we have. We have for other things that are aligned with our mission, which is to empower healthcare providers. And then, so basically that's it. Today's topic is adopting technology into Nigeria's primary healthcare. Are we prepared? By the end of this session, we are going to know how prepared we are, if we are prepared, and all of that. Before I go too far, let me do introduction. I am pharmacist Onyinye Chekwe. I'm the head of community at Drugstock. I also have my colleague Famchima with me here. Famchima, do you want to say hello so that they are hearing other voices apart from mine?
Hello.
Okay,
Hello, good
thanks.
afternoon, everyone.
Good afternoon. Good afternoon, Famchima. Thank you so much for joining. And I have our panelists, our speaker, Dr. Ibrahim Abioye. I have our panelists, Dr. Dorcas, Dr. Caleb, and pharmacist Olajumo. Okay. Thank you so much for taking time out of your very busy schedule to join this webinar. I really appreciate the audience. Thank you so much. And then before I introduce the speaker so that he does his thing, I'll just say a few things. So we have first we have our panelists come on and old promises about how we are going to have prize announcements and all of that. And yes, that is going to happen. So that session is going to be taken by Pharmacist Chima. He's just going to come and announce all of the goodies we have for you today. We said that we have prizes for the first 10 people who joined and who will wait until the end of the webinar. I'm not thinking that we don't even need to use that as a prize, because even saying to the end of the webinar is a gift in itself, because you are going to be so enriched. I promise you. Yes. So I'll go on to introduce Dr. Ibrahim Abiru, the speaker. Now, Dr. Ibrahim, thank you for joining us. And I'll just briefly read his bio. Dr. Ibrahim Abioye is a medical director at Genentech, where he supports the development of innovative medicines for rare diseases. Before Dr. Ibrahim worked in biopharma, he trained as a medical doctor at Lagos State University in Nigeria and practiced general medicine for many years at both rural and urban healthcare facilities. Dr. Ibrahim has master's in population health science from Harvard University. He has extensive experience supporting the design, field coordination, and analysis of population studies in Nigeria, Tanzania, and the Philippines. Dr. Ibrahim also coordinates the Okay, I'm back.
Okay, for me. All right, you're back.
Yeah.
We
I
lost
didn't
you
even know
for
I left. Yes.
okay, we lost you for
Yes.
all
Okay.
right.
Yes. All right. So I was talking about our speaker, about how he has two master's degrees in public health and biostatistics and a PhD in population health science from Harvard, and how he has extensive experience supporting the design, field coordination, and analysis of population studies in Nigeria, Tanzania, and the Philippines. He also coordinates Stats.Clinic. So Stats.Clinic is a non-profit that delivers free web-based courses in epidemiology and statistics to healthcare professionals across African countries. Dr. Ibrahim has over 14 years experience in primary care, patient care, academics, research, and he's here with us to pass on some of this, this knowledge, and we're excited to hear what he has for us. Thank you very much, Dr. Ibrahim. You have the floor now.
Thank you very much, Onye. It's my pleasure to join the call today. Can you please allow me to share my screen?
Yes,
I think it'll be,
yeah, go ahead, try it.
yes. Okay, good. Thank you. All right, thank you very much. It's my pleasure to join the webinar today and to get to talk to all of you about adopting technology in primary healthcare. My goal really is to try to highlight some of the challenges that we might anticipate as we go along, and also profile some solutions, that hopefully will be initial set of solutions that, and then we can expand on as we go along. So the focus of this talk really is in primary healthcare, right? So what's the potential role of technology in primary healthcare? And so the first thing we need to try to understand is agree on what a definition of primary healthcare is. A lot of people have varied definitions of primary healthcare, but what's really essential ultimately is that it is healthcare that is focused on individuals and communities. And there's a number of different components of primary healthcare, and if you ask different people, you'll come up with different lists, right? But this is one such list, and this list incorporates elements of primary healthcare that are directly clinical, where there's a direct interaction with the patient, but also incorporates aspects that are more population level, community level health per se, so like referral systems, how do you put those into place, water and sanitation, promotion of mental health and rehabilitation, stuff that might not involve direct clinical encounters, might not involve direct interaction with specific patients, but have implications for primary healthcare overall. I mean, as many of us probably are aware, primary healthcare in Nigeria, the state of healthcare in Nigeria is actually abysmal at this point, right? There is a huge disparity between the proportion of doctors and patients that we should have in Nigeria versus the proportion that we do have, right? And in the last couple of years, that disparity has worsened. The gap is getting wider and wider. And it's not just for doctors, it's also for pharmacists, it's also for nurses, basically all cadre of clinical staff in our healthcare system. We are having a serious human resource challenge, right? So what that means is that we need to be a little more creative with the kind of solutions that we're going to be able to adopt, and technology is one of such opportunities that we might be able to exploit for this purpose. We also have a lot of healthcare facilities that are not fully functional, right? There's a lot of out-of-pocket spending. So out-of-pocket spending is really critical because if you think about it, there's only so much financing that's possible when each person is spending out of their pocket. There's no aggregated sources of revenue, sources of income that can allow for a more directed, more visionary spending, right? So one of the reasons why in Nigeria there's very few like cancer centers that are operational, there's very few like capital intensive healthcare projects is because of the way that healthcare is financed. And so that's one of the challenges. If we're going to be able to, that's one of the challenges that we have in primary healthcare at this point. I think it's really important to understand what the challenges are. And as soon as we understand the challenges, the solutions will directly flow from there, right? Right now, there's a complete lack. Near complete lack of digital tools for record keeping, for operational efficiency. In the last few weeks, the Minister of Health of Technology, IT, Information Technology was talking about telemedicine, and there was a lot of debate about what's the place of telemedicine given where we currently are in Nigeria, right? There's no referral system. And so what that means is that even if you improve primary healthcare, how do you link primary healthcare with the rest of the healthcare system? And that's an important gap that currently exists. So, understanding these gaps can allow us to then think about potential solutions going forward. Before we think about solutions, however, we have to ask ourselves, what are we really trying to achieve? What are the goals? And, patients are at the core of the healthcare system. And so the first thing we want to understand are what do we hope for, how do we hope to improve the lives of patients as a result of the introduction of technology? In what ways will technology be able to improve patient care? And this is one place where I think that there hasn't been a lot of thinking critically, or a lot of documentation, a lot of evaluation. And so right now we have people introducing different technologies in Nigeria. It's the very beginning of that space, but we still don't have very good evaluation of those projects as they're being rolled out, right? And so to what extent are these improving clinical outcomes? Because ultimately that's why we're here. The goal is to improve patient care, improve clinical outcomes. How are we defining what clinical outcomes we're trying to improve? So we also want to be able to reduce cost of care, improve the accessibility, make sure that healthcare is convenient. People should not have to go for days and days to be able to attend emergency services, right? So these are some of the ways that we can think about the value of technology in primary healthcare. There's also the goals that healthcare that are focused on healthcare professionals. So for healthcare professionals, for instance, we want to help ensure that there's less burden. Today, if you go to a general hospital in Lagos, for instance, maybe each clinician is seeing 50, 60 patients, maybe more, right? How much time do they have to then have a meaningful interaction with that clinician, with that patient? So that burden is just too humongous. And there's a lot of research that has been done that has really documented the link between the workload of clinicians with patient satisfaction, with the mental health of those clinicians themselves, but also with medical errors, right? So one of the goals that we will hope that technology will help address, therefore, is to lessen the burden of the work that healthcare workers are doing, right? And ultimately, that can then have cascading effects on other aspects as well. Technology is also really critical for learning, and this is one of the areas where I think that there are some organizations have started making efforts to leverage the technology, but most of what we have seen with respect to MOOCs and educational services, but there's also additional opportunities like research opportunities, for instance, where there are goals that we need to be able to meet. There's also the government-related goals. So regulation is very critical. For instance, we need to be able to do more with regulating healthcare. Right now, there's a lot of people who are masquerading with certifications that they do not have. And so how do we ensure that the right clinicians, the right people are working as clinicians in our healthcare system? How do we ensure that the supply chain of drugs is not interrupted because of fake drugs, right? Or because people are having trouble introducing new and advanced medicines, right? So these are some of the goals that we need to be thinking about. So, overall, I think that the key takeaway with where the current landscape in primary healthcare in Nigeria is that there's so many new startups that are beginning to find a niche for themselves. And some of them are more well established in the healthcare system and are beginning to make a name for themselves. But there is a huge gap that still exists, areas and opportunities where people can be able to innovate and improve primary healthcare services. So these are some of the areas where I think the next thing will be to then identify what are those areas and how can we improve how can we leverage technology in all of these areas. It's very important to me, at least, that we are able to leverage technology, but it's also important that we can demonstrate that the technology that we're leveraging is meaningful and impactful, right? There's a recent review that I was part of where we looked at the introduction of electronic medical records in Nigeria, and it's across Nigerian health facilities, and to what extent that is improving data quality, improving patient satisfaction, and improving other outcomes. And one of the things that was immediately clear to me is that there's so little documentation of impact. We're not telling the stories in as rigorous a manner as we need to, right? And so when you look at the bulk of work that's going on, we only were able to find 3 papers that looked at the same outcome, and then those looked at data quality and demonstrated that there's improvement in data quality, right? So there is impact that we're making. There's opportunities to make impact. Some people are already making impact, but even that impact is not being, the stories from that impact are not being told, right? And I think that's really critical. And I wanted to share another example of in Kaduna, they're able to put together a birth cohort, the following 3,000 infants from birth and assessing, it's basically child growth. So if you think about, if you're a clinician, you probably are aware of the typical assessments that each child would undergo at every well child visit, right? And these are very simple weight, height, simple, straightforward assessments. But even these assessments, right, if you're able to then leverage technology to record them, to analyze that data, to follow patients up, you will be able to identify patterns, right? That those patterns might not necessarily exist at this point, but patterns that will ultimately be important for patient care, right? So technology is helping to tell that story in Kaduna. I think that there's so many more areas where we can be able to demonstrate the impact that we're making, because then in demonstrating that impact is how you can begin to ask more questions, right? And one of the questions that a group of researchers and they basically went to healthcare facilities and stakeholders in the Niger Delta and asked about their attitudes towards adopting technology. And they did this really beautiful path analysis that shows, ultimately the intent to use of EMRs, right? And because they're able to rigorously assess this, it's more than just, what's your attitude, but also what are the most important factors that are likely to impact whether a person adopts healthcare technology or not. Of course, there's a glaring limitation in a piece of work like this, in the sense that you're asking people about whether they want to adopt EMRs. You're not asking people who have adopted EMRs whether, what factors led them to adopt EMRs. So those are 2 different ways to look at the question. But ultimately, I think what's important is that leveraging technology allows us to start asking questions like this. And these kinds of questions can also impact the business of, the startups that are doing the work. It can affect the clinical care and the clinical outcomes. And like I mentioned earlier as well, there is the impact on the patient, on the doctors and healthcare workers themselves. There's less burden on clinicians, but there's also opportunities for government to think about how to improve the regulation of healthcare, leveraging technology. And we have a really important story in the financial sector, right? There's a lot of sectors that have already started leveraging technology, but fintech has been has been the one that has really led the pack, right? That's not surprising given where the banking industry itself was, but also when you think about the fact that just the sheer amount of money that has been raised in fintech in Nigeria, if you think about the impact on helping to bank the unbanked, which is favorite phrase, but also improve the variety of opportunities and that people who might already have access to banking, the kind of services they are now able to access as a result of tech that's being leveraged. And it's not just in Nigeria, right? It's also all over Africa. There's M-Pesa in Tanzania and in Kenya. And there's all these other examples where we can take a look at and ask ourselves, to what extent can we leverage these resources, leverage these stories to then improve health technology as well? So one question is, are we prepared? Right. So one unique advantage that we have in Nigeria is that we have a very young population, right? And young people tend to be the early adopters of technology, right? But that's both an advantage and a potential disadvantage as well. If you think about the fact that means the bulk of the population is young people are not they don't have as much money, right, as older people. So that's a glaring challenge for businesses trying to bring services to individuals. But the fact that they are early adopters means that if you can be able to figure out a way to do it in a way that's commercially viable, then you're going to find that people will adopt the technological, the tools that you put in their hands. Internet penetration is also more than 50%, which is not where we want it to be. There's opportunities to improve, but it's also really great compared to some other countries, right? The smartphones in almost everybody's hands these days, right? Except people who are like at the lowest rung of the ladder. And so, even for many people who are the lowest rung of the ladder, people have access to WhatsApp and, all these other tools as well that can be leveraged, right? We're already seeing a lot of learning opportunities. And I talked about MOOCs earlier. People are putting together boot camps that can help to train a core of staff who can be able to, because really what we need to be able to adequately deploy technology in healthcare is a not completely new type of healthcare worker, but somebody who is both savvy in technology as well as in clinical practice that they're doing, right? So they have to be able to bring that technology. Imagine if you have a tool that's leveraging AI and you're putting it in the hand of a clinician who cannot even type, right? That's a problem. So we need a new set of ways to train clinicians to use the tools that are already existing. We also have a large diaspora, right, of healthcare professionals, and that's it's not always it's a controversial topic, but that's still a pool that we can be able to access. It might be, so for instance, I remember when I worked in Kogi, for instance, it was a rural healthcare. It was a rural hospital, and we would often have these doctors, surgeons from Canada, if I remember correctly. They would come maybe once every year, spend a weekend, right? That's not enough for the healthcare system, but they always brought like new skill sets, right? And they will train resident doctors to do procedures. That's part of that's a way that we can be able to harness the healthcare professionals that we have in the diaspora. Financing is always important, right? And the healthcare sector reform in Nigeria is going through multiple rounds of push and pull. There's a lot of players, and what we haven't done enough is work closely with the government to ensure that all the thinking that goes into the bills and the policy documents gets translated into actual interventions at the level of the primary healthcare facilities. Some stuff is happening, but it's not enough, and it's not happening as fast enough as we would like, right? So now there's a bill that makes health insurance mandatory. what does that mean? How quickly can we be able to see that financing of the healthcare sector improves as a result, right? So that's one of the gaps that I think is still really glaring and something that needs to be addressed for us to be able to fully leverage technology in the manner that we would like. I wanted to highlight this flow chart. It's basically a patient flow. But if you have a patient who comes into your clinic and into the primary healthcare facility and maybe needs NCD care, right? Maybe hypertension or something. This patient will go through this kind of flow. There's a walk-in or has an appointment. There's paper records at this point. There's a register. Then they will see a nurse or a CHW and maybe a physician in some facilities. So the key point of this slide is that I want to basically highlight to you that even at the level of the patient encounter, there's several nodes, several points where technology can be deployed, right? So if you just look at this and ask yourself, how can I get involved here? What ways can I be able to, what kinds of technologies can I be able to deploy that can help improve primary healthcare facilities? And then you begin to experiment and tell the story. So Drugstock, for instance, is working at the level of the pharmacy and helping to improve access to medicines. And that's really critical. But there still remains other gaps in the healthcare system as well, right? Some of which you will need to think very creatively about. How do you monetize it? Because if you don't monetize, it's hard for it to be sustainable, right? So there's a lot that is not really straightforward, but you have to be able to contribute here. You have to think creatively and figure out ways of working that can advance healthcare for the people. So in terms of the expected impact on primary healthcare, right? We expect that we'll be able to accelerate universal healthcare, attract investments, improve the ratio of doctors, patients, and healthcare professionals to patients, but also facilitate evidence generation. So I'm really passionate about evidence generation because I think that it can look back and impact policy and impact clinical practice as well. And this is one of the ways that technology is uniquely placed to actually improve primary healthcare by if you have an EMR in healthcare system that is basically a fundamental basis upon which you can have a lot of evidence generated. There are some countries where, because there's UHC, there's near 100% coverage for health insurance. And then with technology like EMRs, you're able to follow entire populations throughout their lifespan, right? There's a lot that you can potentially learn from that kind of data, and which will then impact how you're designing new medicines, how you're designing new tech interventions, what you're teaching the people, and all of that. But there's a number of challenges that you need to think about. There's a lot of evidence with respect to resistance to change, right? A lot of the research that's looked at the challenges of adopting technology are focused on the actual health worker, right? But the health worker is not the only stakeholder in the system, right? There's also government. Government is the one who is able to do the greatest job with alleviating infrastructural limitations, right? Cost of internet, as well, is something that governments also uniquely placed to address, but also maybe the markets can be able to address to some extent. Because healthcare data is very important and very private, the cybersecurity represents a unique threat in the healthcare system, right? And so that's something for us to think about. Lack of awareness is an issue, but my sense is that it's not the most important because, first of all, you have to provide the facilities before you start talking about awareness. And with awareness, my sense is that that's one of the issues that is easiest to address, given that we fully understand the ways to raise awareness about that issue. But there's all these other challenges and barriers that I think, like resistance, especially the ones relating that the government is uniquely placed to address, that mean that as a community, we have to have broad-based stakeholder engagement to be able to address them, right? So, and I'm not sure that that's completely happening now. I think that we are in a unique place right now where we have forward-looking ministers in health and in tech who are already working together. And so the issue then is, how do we help to facilitate that conversation that they're having together and help, as a result, advance the place of technology in healthcare, right? That's not something that I think we've done enough, and which we need to think more critically about. So stakeholder engagement, there's opportunities to digitize supply chain, digitize health records. I've talked a little bit about this throughout the talk. But I think that we also need to think about a more multidisciplinary approach to our overall strategy, right? We right now focus on healthcare professionals, but there are other professionals as well who might not be primarily trained in medicine or in nursing or in pharmacy, who might have unique skills that they can bring into the healthcare sector. That's one thing that I think that we haven't done enough, which I hope that we will be able to do more of. Leverage the tools, leverage the skill sets outside of the our clinical practices, outside of clinical practice, right? And use that to then improve the place of technology in healthcare. We had a lot of progress with COVID. Nigeria was one of the countries that was highly rated with our COVID response. And that's really because we leveraged technology at multiple different levels as part of the COVID response, in telemedicine, referral systems, screening, data availability. And so there's multiple different ways that we're able to leverage technology. I hope that we'll be able to take the learning from COVID-19, from our response to COVID-19, and take that into other aspects of healthcare technology. So we have a poll that we would like for you to answer.
Yes, we can have the poll after this. After your talk, yes.
Right. So in terms of future outlook, right? So there's all this potential. I've talked about the potential opportunities that exist. AI is one of the areas where there's a lot of focus. People are interested, and I think that it's really important for us to be able to deploy AI for diagnosis, treatment, as well as for other aspects of healthcare. But it's not just AI, right? And we don't even have health data right now that we can leverage, that we can use to leverage AI. So without the real-time health data, it's hard for AI to be useful, right? So our health data is currently sitting in case notes all over the country, as opposed to sitting in the cloud where somebody can be able to do some analysis and make predictions and use AI, right? That's an important gap that really exists. I've talked about the need for healthcare professionals that are doubly qualified, that have multiple skill sets to be able to fit very well into the future that we're seeking. But there's also other aspects as well. So business support services like IT, supply chain, education, these are all aspects that some of which go beyond the healthcare professionals, right? But which are essential for us to be able to be successful in this regard. We have to think about evaluations of make sure that we're telling the stories make sure that we're telling the stories of the work that we're doing, and make sure that those stories we're telling them in a rigorous manner as best as possible. All of us are going to benefit if we tell those stories correctly. So are you prepared? This is the question that I'm now posing to you that I want us to think about, and which is some of what I hope that we'll talk about during the panel is, do you think that you've identified partners that you would like to work with who can help address some of the gaps that exist, that with whom you can co-innovate, with whom you can improve the use of technology in primary healthcare. Thank you very much.
Thank you very much, Dr. Ibrahim. That was really thought-provoking and powerful. Like I had to exhale. I found, the parts where you talked about not creating technology or not adopting technology for technology's sake, but having clear goals, the patient-oriented for the healthcare provider, for the government. We should just have specific goals. So we're not just using technology because it's in vogue, and then identifying opportunities so that the technology we adopt are actually relevant. I think it's just spot on for us. So we are taking questions now, and we are also going to have questions of our own to ask you. So we can put out the poll now while people drop their questions, and then please interact with the poll. It's intermittently on this webinar, we are going to be engaging with you to also hear your thoughts. Yeah, we have panelists on the call who will, share their thoughts, share their experiences. But would also like to hear from you because we can't all be panelists, right? But would also like to hear your thoughts or survey your opinions via the poll. So please interact with the poll, and please you can drop your questions now or your comments while I introduce the panelists. So please feel free to drop your questions in the question and answer box, or comments or contributions that you have for us. We know that healthcare providers are here and you have experience or you have worked with tech in some way. Thank you so much. So I'm going to go on to invite the panelists now, the first panelist session we are going to have. So I know that primary healthcare can be accessed in many ways, hospitals, and then we have the community pharmacies. I've come across something that says that community pharmacies are usually the first point of call for healthcare seeking people in the community. So we are going to have that session for community pharmacies, and then we are going to have for the hospital setting. So the hospital setting will come first, and for that we will have Farm Dr. Dorcas and Dr. Caleb. So pharmacist Dr. Dorcas is the head of pharmacy unit at the Unilag Medical Center, and Dr. Caleb is the deputy medical director at Optimac Tech Fertility Solutions Limited. He's also a fertility consultant. So we are going to be, hearing a lot of solutions for fertility related solutions regarding tech, of course. So welcome, Dr. Dorcas and Dr. Caleb. Are we here?
Hello, Famoinye.
Yeah, good afternoon.
Yeah,
Dr.
so
Dorcas. Yeah.
yeah.
Dr. Caleb, can you hear me?
Yes, I can. Hello. Good afternoon.
Okay. Good afternoon. All right. So I'm going to start with you, Dr. Dorcas. So
Okay.
So what role do you envision pharmacists and other healthcare providers playing in the future of technology-driven healthcare delivery in Nigeria?
Yeah, thank you very much. I'm glad to be here to add value and equally to add value and equally to receive value. Let me appreciate Drugstock and all the participants in this program. It is a privilege to always get knowledge and also to impact knowledge. So in terms of the roles that primary healthcare providers have to play in terms of deploying technological innovations and solutions in healthcare provision, I would like us to think globally. When I say think globally, our focus should be what is happening at the global scene. Then we can now come back and act locally at our level to see how we can scale up or how we can step up to the global scene. So meaning that whatever I'm saying here is we should pick it from what is happening at the global level. Basically, I see the roles being more of continuous learning, knowledge seeking, because everything boils down to knowledge. We have to learn how to use the new technology. For instance, AI is now all over the place, but we need to learn how to deploy it. In healthcare, we have legal issues, we have ethical issues, we have patient confidentiality issues. And so we must be able to learn the best way to deploy this technology without infringing on on the patient's rights or outcome of treatment. So basically knowledge seeking. And in seeking knowledge, you must also be ready to take the lead in deploying this change, because looking at where we are and where we want to be is a long journey. And so it will need some disruptive changes. So there's going to be need for understanding how to manage change. So change management, okay? So we need to upskill in those areas. We're also going to need to collaborate with other team members, other hospitals, other organizations. So we must need collaborative knowledge and skills. There should also be cooperation so that we have harmony, okay, in carrying out our, I look at basically learning, continuous learning, upskilling. We must be great decision makers, great communicators, leadership skills, okay, leadership roles, teaching, research. And of course, we have to be continuously learning. That is the lifelong learning. Yeah.
Thank you so much.
So those are some of the
I
roles.
agree. So leaders, we have to lead the change basically, because like we are the ones at the forefront of this. Lead the change, manage the change, learn continuously to upskill. Thank you so much. So I can see that we have some questions for Dr. Ibrahim. So we'll just quickly wrap up this panel session, and then I'll have Dr. Ibrahim come back to answer these questions. So Dr. Caleb, please, I have a question for you. What specific, so Dr. Ibrahim mentioned a lot of, tech advancements for primary healthcare, but then what specific advancements do you believe are most critical, like currently, for improving primary healthcare in Nigeria? Dr. Caleb, did you get that?
Okay. Thank you very much, Amoni. Yes, I did.
Dr. Caleb, okay, great.
Thank you very much, Amoni. Good afternoon. I wish to stand on all existing protocols. So, what specific technological advances do you believe most critical to improve primary healthcare in Nigeria? I do not think there's a single specific technological advancement that's most critical to improving healthcare in Nigeria. I think there's a wide So,
Dr. Caleb, I think I'm struggling to hear you. I don't know if it's just me, but it's not very clear.
First, the health system.
Can you hear me, Dr. Caleb?
It's breaking.
Yes, I can hear you.
Yeah, but I cannot hear you clearly.
So is it now? Is it better now?
Yeah, it's a bit. Yeah, so just go on, please.
Okay. Yes. I don't think.
Yeah, so you were saying that you think. Yeah, you don't think there's anyone that is most important.
Yes, there's a wide time. Yes, I think all critical, a number of them, and they work in tandem on synergy. So I was to anyone system. So the health information system, the HIS / the medical record. So that involves electronic storage of patient data, including the professional drug loads, diagnoses, medications, and etc. Okay, so that works with the telemedicine. So the telemedicine, for the telemedicine, it involves the provision of remote clinical services. So you're in your office and you're talking to people in remote areas, trying to bridge the gap of difficulties in the center.
Okay. Thank you very much, Dr. Caleb. So I got that you said telemedicine and health information system, but I'm not able to hear. I'm really struggling to hear you.
I think it's maybe the network there is not stable.
Yeah. All right, thank you very much, Dr. Caleb. So I'll just move on to the next question really fast. So,
It's
Dr.
them,
Dorcas. Okay, Dr. Caleb, I'll come back to you. Dr. Dorcas, please, can you share some success stories or examples of how tech adoption has impacted patient care? It struck me when Dr. Ibrahim said that there are lots of impact, or there is a lot of impact that tech has had in the healthcare space, but these stories are not being told and are not being documented. So, are there any in your facility, and could you share, if any? So, share the
Yes,
story.
thank you very much. Definitely, yes. I actually agree with Dr. Ibrahim when he said that the state of healthcare in Nigeria is abysmal. That's a fact. But also, we have success stories that are not being told. And I think ours is part of it. But before I go into the success story, I must acknowledge the fact that being in a public sector, being in a team setting, nothing happens without leadership support and team cooperation. So I want to give it to University of Lagos, the entire management, for the enabling environment, for the leadership support that enables us to do what we're able to do. I equally want to appreciate the medical director of University of Lagos Medical Center for the leadership support, and of course, the other team members across other professional groups and the pharmacy team. So it's not a one-man show. Whatever I'm sharing here has been a product of teamwork.
That's
so
great.
for instance, we started our own digital journey like 20 years ago, where we got the community pharmacy automated with CCTV, and it's still running till date. And at the medical center, we are running what we call online drug refill. So when I say online drug refill, it's for our clients or patients who are already stabilized but on regular medication. So rather than coming here every month to queue up for their medication, we created an online platform where they request for their drugs online a week to exhaustion of the other one. So they come here, the drugs are already packed and labeled, and they just pick up and take counseling and go. What is the impact? The impact is that patient waiting time has drastically reduced. The patients are satisfied. They actually openly express their satisfaction over this. Secondly, we have, or let me say thirdly, or fourthly, we have the telemedicine booths being run by the Lagos State, that are placed, on campus here in the hostels. So we have students that don't have to come here. They go to the telemedicine booths, get their prescriptions, and come straight to the pharmacy. You will say that maybe the burden is still on pharmacy, yes, but of course the waiting period is reduced. Our target is to reach patient experience. So at the end of the day, they have, because of the shorter waiting period, because the patients are more satisfied. Students are happy for that. It's the same population. So let me just round up what else we do here. We also have WhatsApp platform for special patient groups, and our EMR or electronic medical record, electronic health record is ongoing. It's in the teaching stage, but we hope that very soon it will run smoothly. So those are some things, innovative things we are doing here at Unilag Medical.
Great. Dr. Caleb, can you hear me now? Are you there? Okay.
Yeah, I switched to another device. I've left my PC. I've switched to my phone.
So I think it will be a lot better.
Okay.
All right. Yeah. So I'm going to ask, how can collaboration between healthcare providers and tech developers be enhanced to better meet the needs of Nigeria's primary healthcare system?
Oh, okay. Yes. I think the onus is on government to spearhead the strengthening of collaborations between healthcare providers and technology developers by creating the enabling environment through provision of power, internet access, and other critical infrastructure. There also needs to be an inclusion of healthcare providers in pilot programs on health matters. Like, healthcare providers need to be part of legislations and policy making in the Ministry of Health and other allied, under health allied bodies. There should also be intersectoral collaborations, like Dr. Abiy was saying. So, the health sector and the digital industry, they can do a better collaboration. There can be intersectoral, different sectors collaborating. And when this happens, there has to be a willingness of both parties, that's the healthcare providers and the technology developers, to incorporate appropriate technology for the betterment of the patients. Yes.
Yeah, I heard you when you said that healthcare providers should be integrated in the building of these tech tools. Yeah, so we should like their opinions and their identity, because which is very which is interesting, because I know that for us at DrugTalk, that is something that we prioritize.
Okay.
So we do that because we know that healthcare providers like we are doing this tools, we are creating these products for them, and their inputs, we get their inputs, we get their feedback, and then it just helps to make the product better. So thank you very much for that point. I really totally agree with you. So we're going to thank you. So
okay.
Yeah, thank you so much. So we're going to take a pause on our panel session now, and I'm going to go to the questions for Dr. Ibrahim. We have a couple in the question and answer session. So Dr. Ibrahim, so how do we ensure the inclusion of illiterate patients, those that don't use Android phones, and those living in locations where there is no internet? In addition, does the EMR depend on internet, or can the software work optimally without internet?
Thank you very much for this question. And so there's two parts to the question. I think that those two parts have two separate answers. The first one is about inclusion. And really the issue about inclusion is a little bit controversial, but I think that we have to do what we can with what we have, right? So what that means in essence is that there are some tools that you can already deploy that you can deploy in a rural area that might not necessarily, require that the patient themselves have access to technology. But the other aspect of this question really is that inclusion is good, but first of all, the people who already have technology, we also want to ensure that we can leverage the technology that they already have, because I fear that one of the challenges that we usually run into is that when people push back on, people talk about inclusion, there's a risk that the search for inclusion keeps everybody stagnant, right? So the people who already have access to technology, we want to help them leverage the technology that they have to. The people who don't have access to to Android phones and stuff, we do what we can, right? And one of those ways, and that's the EMR, for instance, question that you asked, is whether EMR depends on internet. That also goes to the heart of the question of how do we do what we can with what we can, right? So there are EMR applications that require internet services, but not all of them require internet services, right? So in selecting the EMR tools that you're going to deploy in a rural area where internet service is not steady, right? You want to choose EMR that can sit on the computer, doesn't need internet service, and maybe once a week you can connect it to the internet and sync with the cloud, but something that can work without internet to be really critical in our setting. So this is really how to balance the need to include as well as the need to advance. Thank you.
All right, thank you so much. And then so someone else is particularly interested in how we can evaluate the impact of technology in reducing and mitigating medication error.
Yeah, so evaluation is really interesting, right? I think that one of the most important things we need to pay attention to is that there's multiple ways to evaluate depending on the goal that you're seeking. So we need to first of all define the specific goal for the evaluation, but there's multiple approaches you can take. So one of those is spot checks, right? Look at medication that each patient is receiving versus the medication they should be receiving. That's the most simple, straightforward approach. But there's with technology, surveillance becomes possible, where you can begin to look at patterns over time, right? And those patterns, some of the things that you might then be able to incorporate is like community reporting, where patients who have maybe patients who believe that they might have had wrong medications prescribed, or health who identify that wrong medications have been prescribed, can report into that system that you then use whatever other tech tools that you have to leverage. So it requires a little bit of thinking, but there's multiple approaches. I've talked about spot checks, surveillance. Perhaps the approach that most people will also use is dedicated, like purpose design studies that are designed in such a way that you can rigorously evaluate. So you incorporate the evaluation into the deployment of the technology itself, right? So there's multiple different approaches. You think about the costs and what you can afford. You think about the resources that you have, as well as the goals, and then select what works best for you. The best evaluation approach is likely to be both, right? That's something that incorporates qualitative and quantitative methods. Thanks.
Okay. All right, thank you. I hope that answers the question, Ibrahim Amigo. And then, yeah, so another question here is, how do you plan to, or how can we tackle the acceptability issues among healthcare professionals? Yes, we need this innovation in the primary healthcare, but will the professionals be willing to adopt it? So that's a good question.
It is, yeah. So if you remember, so I shared this path analysis that looked at the question of adoption of EMRs in particular, but that not just EMRs, there's multiple other tools that for which we can think about why are people hesitant to adopt, and then you begin to address those reasons why they're hesitant. So if you have a fair understanding of the reasons why there's hesitation, then you can design maybe education or other approaches to help people see why why they should be adopting those tools. So for instance, burden. If healthcare workers know that the deployment of this tool is going to ease their burden, I suspect that most of them would adopt it. But the issue is, because we are not telling our stories well enough, it's hard for people to overcome their initial resistance. And that's really what we need to pay attention to. Telling our stories, telling the right stories based on evidence, and using that to craft our plan of action.
All right, thank you. So before I go to the next question, I can see that Chima wants to answer the first question, the question on how we can tackle, no, not tackle. Chima, please, what question do you want to answer? Just feel free to unmute and speak.
So it's the how do we ensure inclusion of illiterate patients, those that don't use Android phones, and those living in locations where there's no internet. So
Okay.
which is something I was going to talk about in the introduction of our ecosystem, and of course the app we have. So we have a device that works for the healthcare professionals to both manage their inventory and manage their patients. And in managing their patients, they get things as simple as, notes on their ailment and whatever they have to take down on pathophysiology or whatever. And there's a consistency in their records. And the beautiful thing about this is, because we know internet connectivity and internet penetration is debatable and it's unstable. And the beautiful thing about this our tool is that it works offline and online. So it is something that, from the primary healthcare centers up north, or, in the remote areas in the south, they can actually use it to manage their drug, drug supplies, and also use it to manage their patient and cascade through a referral system embedded on the solution. So that's that for the
All right, thank you.
managing the period. Thank you, Onye.
Okay, thank you, Chima. I think it's important that technology developers in Nigeria understand the environment. They they read the room, and then you have to create technology based on the landscape and based on the environment. So I think that is just really important for technology developers so that to enhance adoption. Yeah, so how do we lobby with the government officials to implement strong policies on intellectual property rights and market access?
I don't know. I think that first of all, we need to understand what does the government want. So one of the challenges I believe with engaging government is that we are always thinking about what we want from the government, right? But the right approach to engaging policymakers is to ask yourself, what do they want? And how can I align my own agenda with theirs in such a way that I'm helping to advance the agenda while also advancing the agenda that I'm interested in? So a typical example that comes to mind for me, and this just basically goes out of what we're talking about, is in Lagos, for instance, many years ago when Bola Tinubu was governor in Lagos, there was the issue of the College of Medicine, right? And there was a College of Medicine that had been started by the preceding government, and when he came on, he was not given the College of Medicine as much funding as people wanted, right? And the government, it was well funded, salaries were paid and all that, but the College of Medicine needed, like, setting up a College of Medicine really is transformational. Like it requires a lot of money. So the governor has to be like fully engaged, fully invested in the project. And so the leaders of the school and the community, what they really had to then do is to help the government see the value of having this College of Medicine, despite the fact that there's another College of Medicine in the state, right? So so this is basically just an example, and this is something that they struggled a little bit. Eventually, they figured out that this is a governor who needs to win the next elections, right? How do you help him to see that winning the next elections? How is healthcare going to feature in winning the next elections for this person, right? So in telling that story to help to the government, to the policymakers, is how you get their support. This is a fundamental aspect of policy analysis that many of us we struggle with because we're focused on what we are going to benefit, right? So this is one thing I think that the health tech community needs to think more critically about. How do you engage with government? It really requires aligning your own agenda and your own goals with theirs, and to make sure that you're successful. Thank you.
All right, thank you so much. Thank you. Oh, thank you very much. And please keep the questions coming, and please feel free to drop comments because this is like it's a conversation, right? And it's an ongoing one. Even outside this webinar, we'll still be having it. But while we are here, please drop your ideas, your opinions, your thoughts, and of course your questions. So before I go back to the panel session, and I know that some people are already looking at me with side eye, where is all the gift you promised us? So from Chima, so please I'll just invite you now to give the announcement and talk about everything that you have for us, because we're in the season of giving, so we're expecting that you have stuff to give us.
Thank you, Onyinye, and
yeah.
Thank you, Dr. Ibrahim, and the rest of the panelists for taking out of your time, and also thank you to the healthcare professionals too for taking out of their patient time and the enjoyment time to join in this conversation. And it just goes to show that you're passionate about your patient care and things to do to improve your practice. I guess I'm the digital Father Christmas. So I'll just talk a bit about the new app we launched. So the mission of Drugstock is empowering healthcare providers. And when you check the word empowerment, it means so much, especially to our healthcare professionals that are stressed. And you can say the reward is not so huge. So empowerment means so much to us.
Reward is not in heaven anymore.
To us and means so much to them. So primarily we started as, when you think about primary healthcare, what you figure is that it's taking care of your patient in the simplest way. And it's usually maybe the one abstract and a physical thing. The abstract thing is like the advice you give them, and the physical thing is like a care, like a product. And when drugstore started, it started to fulfill that need of helping healthcare professionals to give the right products. Now, everything about that product, track and trace, quality, it's sorted because it's drugstore, and we have passionate people about public health. We have pharmacists and doctors and supply chain professionals here, and we started solving that need. But, because we said we are passionate people about health, public health, technology, we discovered the healthcare professionals need more. They need more. I mean, it's not about the hero saving people and the hero not being taken care of. So we also now understand the Hydra-headed issues when it comes to things like funding, reliability on their supply chain, things like even learning. Even sometimes in the largest of these pharma companies, they do discounts and promotions, understanding the times of endemic nature of things. Sometimes the healthcare professionals are cut short because the middlemen or the salespeople too are taking advantage of those things. And sometimes even in scarcity, there's price gouging.
True.
And all those things, when we understood the trend, we decided to create an app that can take care of all these needs, from learning. I mean, this webinar will be in our Drugstore Learning Library, where you can go back and refresh. And we also have more content that you can go back to refresh on our Drugstore Learning. We also have product updates from companies where you can see latest medical information on drugs, whatever is happening in the US or wherever they're doing the research. You can see we have that platform that will be active as from next month. I wanted to say next year. I realized it was next month. So we also have things like this we'll be doing from time to time, because this digital transformation in the healthcare system is a webinar series, and you'll be seeing update once you're on the app. And also on the app, you can get as quick as access to rare medicines, and you can get to know drug interaction from. You can just check your app and you know that you get to know the price and the best price in town. And you also get to see the latest events happening, webinars and the rest on our banners. And this is a place you can also get direct feedback if you need to call the customer care. So it's a fully immersive app, if I must say. And in the spirit of season, we are already starting the reward system. So you can consider it as the leg of the discounts that you enjoy. So for the first 10 people that joined and will stay to the end, the first 10 people, we'll be giving them vouchers that are redeemable on the app when you purchase anything. I guess, I mean, for some that will be traveling or sending things to their loved ones, they can buy multivitamins or whatever. For the lady pharmacists, there's CeraVe. You can get those and send as gifts in this season. And we also have the in the like 12 days of Christmas, for the first 30 people, first download. I mean, for the first time download, and you've not purchased, if you purchase now, between now to 31st of this month, the first 30 purchase, and if they are first time download, you get the gift items once you're receiving your stock. Then we are also launching a referral system next month for healthcare professionals, where if they get to refer both individual pharmacists or businesses, and we reward them. We have different modalities for that reward. If it's when you refer a business and they buy their first 1 million, we reward you in the year that this for your referral. Thank you for your referral, we reward you. We have different ways we communicate that reward system as from next year. So a link will be shared for the referral so you can register. So in general, we can reach out to you to communicate to those that indicate their interest on what the reward system will be. So you can register on the link. And also, I would like us to know that this app is just one of the digital assets we have. And we have other digital assets. And once you join this, you begin to experience the other, because I spoke about, what a powerful tool it would be to have our pilometer in remote areas. And now you can stay up to date. So that's another one. And we have the Drugstore Pay on the app, where you can also leverage for supply chain financing. So thank you. And I'll be happy to see who the first 10 people that joined and stayed to the end to get the awards, and for the 30 people that first time download that will be buying to get their reward items. Thank you, Onye. Thank you. And thank you, everybody.
Thank you. Thank you, Fam. Thank you, Chima. Like, you're just giving out prizes. First person to do this. People who wish Drugstock Merry Christmas. People who say Drugstock to their friends. People who think of Drugstock get gifts, right? Just outpouring of gifts, yeah. Thank you so much. So so you said the CeraVe, you said lady pharmacists who can get CeraVe. So I don't understand. Men don't use CeraVe. I'm not getting it.
Oh, sorry. Men need
Everybody,
CeraVe.
don't
Men
mind
need
me. All right, thank you. So we can play the
Ready to simplify your healthcare practice? Meet the all-new Drugstock app, your digital assistant designed to empower you to manage pharmaceutical procurement and medical information right from the palm of your hand. Our new app embodies our healthcare provider-first philosophy, focusing on user-friendliness and functionality. Whether you're looking for clinical information, managing orders, or making informed decisions, Drugstock provides a seamless experience. Confirm drug interactions, side effects, and contraindications. Quickly find therapeutic substitutes, access drug-related information for personalized patient care, and stay updated with the latest medical news, industry trends, and events. Whether you're at the clinic, hospital, or a healthcare provider on the go, you can also access a vast catalog of over 7,000 high-quality pharmaceutical products, including medical consumables, rare medications, and small medical devices from trusted brands like Pfizer, Sanofi, GSK, and more. Stay organized with intuitive categories, manage payment options, and track all orders in one convenient place. And with our latest feature, the Drugstock Pay Wallet, you now enjoy a secure and convenient payment solution, which allows you to transfer funds to and from your wallet to any bank account of your choice. Being a healthcare professional is already a challenging endeavor in our corner of the world. That's why at Drugstock, we've made things easier, allowing you to spend more time on what truly matters. Caring for your patients. Ready to elevate your healthcare experience? Join thousands of healthcare providers already using Drugstock to transform their practices. Download the new Drugstock app today on Google Play or App Store and take control of your practice like never before. Drugstock, your partner in healthcare procurement and patient care.
All right, thank you. So there are some questions in the question box, but we have some questions of our own too, like I said. So please interact with the poll on your screen so that we'll get some we'll take away some of your opinions on the subject matter. All right, so someone is asking how much. I'm not quite sure what you're asking about, but if it's the app is available on Play Store or on the App Store to be downloaded for free. There isn't any price attached, but I think Chima can engage with you further to know exactly what you're talking about. So we are going to go back to our panel session very quickly. The panelists have 3 minutes top to answer each question, less than 3 minutes. So I'm going to invite pharmacist Olajumoke Lawal for this session now. Pharmacist Olajumoke, are you there?
Yeah, good evening.
Good evening, So Pharmacist Olajumoke is the superintendent pharmacist at DrugRight Pharmacy. So thank you very much for joining us. Thank you for your time. So I'll just launch into it. What strategies or support systems? So we have talked about tech and all of that, but now we are talking about I want to understand how in your experience or in your setting, how we can, or what strategies or support systems that pharmacists in your settings, community settings need to be more prepared and confident in adopting technological changes in their practice. Do you understand that?
Yes, ma'am. Thank you for having me. Good afternoon, everyone. Or
Good
should I say
afternoon.
good evening? It's been insightful all the way. A number of these has been answered. I mean, this particular question has been answered in the course of the conversation. So I'll just summarize everything into 3 points. Number one is interest. Interest, the mindset, the attitude. So we need to understand as community pharmacists that technology has come to stay. There's no going back from it. It's that we accept it or we accept it. There is no alternative. We can't go back from it. So when that is settled in our mind, we know that we need to embrace it. And whatever we need to do to be involved in it, we have to do. And one of it will be training. That has been mentioned earlier. We need to train and retrain. We need to learn how to use this technology. We need to learn how to use this app. We need to move from the mind of help me do to the mind of teach me how to do. As simple as how to use an Excel, how to use a Zoom link, how to use whatever it is, even on your phone. You don't have to depend on your child or your staff for some things. We need to begin to use this technology. So if there is need for us to take on courses that will help us, to love it and use it more, we need to do that. That's one. Number two that I'm going to look at is collaboration with these tech companies. There is need for tech companies to partner with pharmacists, in this case, community pharmacists, which are going to be the end users of these solutions, on what their challenges are, what their concerns are, how they can come in, how they can use tech to solve their problems. So they need to be involved. When we are involved in development of that solution, we feel like we are a part of it. And so there is no way we will not want to embrace it because it is something I contributed to. So I want to be a part of it. And naturally, I will want to even talk about it and say, my contribution is there. Yes, I can use it. You can also use it. I can recommend to people. Why? Because we are a part of it. And then the other thing is that there is need for a feedback mechanism on the usability of and effectiveness of whatever solution is. So if they take feedbacks from the users, which are pharmacists in this case, and then, we see that, okay, our opinion matters, our feedback matters, we will embrace it more. And finally, in that collaboration aspect, I'll look at technical support. It's one thing for you to have a solution that if there is an itch, you can easily reach out to somebody that's, developed it and say that I have a problem. And, the problem is not affecting the practice or the business at any point in time. So there is a support system, more like a customer service kind of system that comes in within the second or minutes, and it doesn't take days, because that's another thing that'll make pharmacists not want to embrace it. They'll be like, this thing would disturb my process because they don't have good technical support system. So we need to look at that as tech solution companies and pharmacists coming together, addressing these issues in ways that we can adopt these solutions to help in our practices. And the third thing I want to look at has also been mentioned, which I will term peer support network, meaning that, I think it was a doctor, the speaker or one of the panelists that mentioned that, when you tell the success story, I've used this app, I share the story of the challenges, the interesting part, how it has, helped my practice, help in the footfalls, help in the profitability, whatever it is bringing.
Yes.
And, I share the story with somebody else who wants to adopt, to be like, because I have experiences of that. There's a particular solution we're using right now in my pharmacy right now. That's when I talk about it, in fact, I talk about it to a tech company that came together to talk from us, and it was surprised. You had to ask for the number of the people that developed it for us, or the owner of the company or something like that. I had to give it to them. In fact, that one reached out to me and said, yes, this person called me and all of that. I know a number of persons that have picked up that solution by the virtue of what we told them from my experiences. And we've been using that for over 5 years now. So I think the success stories like that can, encourage pharmacists.
Encourage others.
Yes, that solution. Thank you.
Yeah, thank you so much. All of what she said really resonated with me, because I keep talking about, because I am always in the process of our tech development and everything. So hearing you speak is like you work with us, or you are a fly on the wall when we launch our products, because it's something that we hold sacred. When we are launching anything, or when we are starting to create a new product, to get the opinion of healthcare providers, that's something that is sacrosanct to us. We absorb them, and then we integrate them into the ideation, and what can be better. You mentioned feedback. That's something that I think will hasten or will accelerate the adoption of tech. So yeah, I think that it's something that more tech companies should integrate. And then the peer support, I totally agree. It should that is something that will definitely work. Thank you very much for that. And then the second question for you, I think you already mentioned it, but I don't know if you have any particular one you want to share, any specific training or initiative that you believe will enhance pharmacists' readiness to adopt tech. Does anyone come to mind immediately, just in 2 minutes?
I'll just say that
30 seconds.
there's need for us to just pick up little basic computer knowledge here and there, Excel solutions, how to use Excel, basic computer skills, data analysis. There's all those courses online, free courses that we can pick up that can help us just develop interest. And other, I think there is need to introduce tech into pharmacy curriculum from university, so that people can begin to know that we can't separate pharmacy and technology. It has come to stay. It's a marriage that there can never be divorce in it. We can always keep going together. So we need to begin to adopt technology from university days, but there are little courses here and there, free online, that you can see that we can go here and there.
Thank you so much. Thank you. So I have some questions in the okay. Iberi is saying that he would love, or she would love, to work with or to learn. Yes, that is something that we value a lot in Drugstore, because empowering healthcare providers is at the core of what we do. So any form of empowerment, especially learning. So we have Drugstore Learning, where healthcare providers can log in or sign up and get all of the resources that they need. Yes. And then so the webinar will be done soon. Yeah, we're almost done.
Yeah.
We're almost done. Thank you very much, Olajumoke, for your insightful questions, responses. Thank you so much. So so we have come to the end of the panelist session. Thanks to everyone who participated and engaged and joined and waited to the end and there to the end. Thank you so much. So I'll just quickly reiterate everything that has been said. For the reward, so Chima spoke elaborately about it. We can, participate in the referrals, in the referrals program that will be happening next month. So you can just fill the form. There is a form in the chat box. So just fill it, and if you'd like to participate next month, there will be a special message sent to alert you. So if you want all the people to know that, or to learn of its commencement. And then of course there's the purchases. So for the first 30 people who download the app and make a purchase, get free gifts or get something. Is it a surprise gift? Yeah, get something definitely.